Hello, everyone. Welcome to Ask Concussion Doc. What's the date today, Rico? Wednesday, October 24th. Don't know what date it is. I have with me today Dr. Paul Hrkal. He will be joining us. First, just an announcement to make. Concussion Chronicles is a new thing that we've started, and the first issue is about to go out the first week in November. And what Concussion Chronicles is, for those that aren't aware yet, we go through the research every week, and we break it down. We have a research team that kind of reviews all the research, and what we've decided to do is take the top articles and studies each month and summarize them for you and have them sent directly to your inbox via email. So if you haven't signed up yet for Concussion Chronicles, make sure you do it. The first issue, we're talking about Ketogenic Diet, which we'll talk about more today. And we're also talking about high-intensity interval training and its relation to concussion biomarkers. And we're also talking about exercise as a treatment for acute concussions, which kind of goes against the conventional thought there. And so if you haven't signed up for Concussion Chronicles, you can do that on CompleteConcussions.com. And it's one of the drop-down menus. So you can sign up there. All right. Without further ado, Dr. Paul Hrkal is a board-certified naturopathic doctor with a passion to apply innovative and evidence-based nutritional, biological, and supplemental interventions to address underlying metabolic, endocrine, immunological dysfunctions. Dr. Hrkal has a special interest in neurological health and chronic pain. He is currently the medical director for Advanced Orthomolecular Research, AOR, an innovative and leading Canadian national health product company, and maintains a clinical practice in Toronto area at 2 integrative clinics. He is also, which he failed to mention in his bio, on the medical advisory board for Complete Concussion Management, and he teaches the section on diet and pharmaceutical interventions for concussions. And so we've all been very pleased to be able to learn from Dr. Hrkal over the years, and I'm sure any CCMI clinician that's out there will tell you the wealth of knowledge that this man brings. And excited to have him on the show. And actually, this is, the second time we've ever had a guest on the show. So Dr. Hrkal, thank you for being here.
Thanks for having me, Cam. It's a real pleasure. Just to touch on the chronicles that you mentioned at the beginning, I think the biggest benefit of CCMI is the research that you always keep the members and the clinics and clinicians up to date with. And this is just a really great option of having access to this research that you might not necessarily have to be a clinic. So really excited for that for the people that are part of our network.
Yeah, I mean, we've been doing it for our clinics forever.
Exactly, yeah.
And so we thought, okay, there's other people that could benefit from this, and so that's kind of why we did it. But yeah, it's pretty cool. So we're ready to get into our talk about.
Awesome. Thanks for having me.
Yeah. Okay, so pathophysiology of concussion. You're talking an accelerative force. You're talking mitochondrial dysfunction, ATP deficit.
Mm-hmm.
Now, because this injury is this metabolic thing, we've never really had treatments for concussion. It was basically sit, wait it out, don't go back to sport too soon, don't put yourself at risk for injury. Now, from learning from you, what can we do, let's say in the acute phases, like talking about, actually, let's just dive into pathophysiology, right? So,
sure.
Mitochondrial dysfunction following that injury, leading to a reduced production of ATP.
Yep.
Now, is there anything acutely in that process that could be targeted therapeutically, let's say, as a preventative measure for concussion?
I get this question a lot, whether it's an athlete saying, hey, I've had concussions in the past and I'm just trying to do something to prevent myself from, having the prolonged healing process that you might have or improve my ability for recovery. I just want to point out right from the beginning is that there's no research on this particular area. A lot of what I'm going to talk about right now is about understanding the pathophysiology and then applying functional medicine and the understanding of that physiology. So what we know right off the bat is that there is an immediate excitotoxic cascade, and that primarily is calcium going into the cell, and majority of calcium and sodium are outside the cell. And they really get switched. And what that does is that basically overwhelms the mitochondrial ability to create a gradient. So that gradient on that cellular membrane is what allows the ATP to be produced. So basically that environment is damaged. You can't produce ATP. So what the mitochondria in the cell does is that they try to pump out all this calcium ASAP, and it just uses up all the ATP. So that's why you have an initial hypermetabolic phase, very short, and then you have this depressed hypometabolic phase. So right off the bat, just because I said calcium, you can right away look at what are things that we can do, and this is probably going to be preventative, is to offset that cascade. So number one...
So before the injury happens.
That's right.
Okay.
Yeah, so because this, you have to understand, this takes days, weeks sometimes to be incorporated into your cellular machinery. Like, for example, fish oils, to get into the cellular membrane, it sometimes will take weeks, maybe if not months, to really incorporate. So a lot of the things that we'll talk about today, really, you probably should be taking before to get the optimal effects. Now, that's not to say that you can't be therapeutic after. It just means that you probably missed a bit of the beneficial window.
So you're working an uphill battle to try and
build
your stores. But if you had the stores beforehand, you'd be in a better position.
Exactly.
Okay.
And so maybe you won't have such a depressive phase of the ATP. So basically, I'm a big fan of magnesium because magnesium and calcium counter each other inside the cell. So calcium and sodium outside, magnesium and potassium inside the cell and inside the mitochondria. And they're the ones that kind of create that gradient. And anytime you have a muscle contraction, a nerve conduction, those quickly switch, and the body recreates that homeostasis. So if you have optimal magnesium, and we know research shows in animal models that magnesium levels go down very quickly after a TBI. And so what we can do is optimize those magnesium levels. I think that's a really good way of offsetting that calcium excitotoxic phase. So that's the first piece. It takes probably, I would say, 3 months to really get magnesium into your cell fully. A majority of the magnesium is stored inside your bones, and that's the place that is the storage tank gets depleted first. So if you are in a state of high exertion like an athlete, research shows that 90% of athletes are deficient in magnesium. Anytime that you are going to have any sort of medications that block stomach acid, you're going to be deficient in magnesium. So those are like things like Tums, proton pump inhibitors. If you're eating highly refined diets that kind of have this negating effect on our digestive juices, they are going to also inhibit the absorption of magnesium. So that's pretty much everyone in North America.
Right.
So everyone is walking around with a subclinical deficiency in magnesium. And the reason you don't see it on blood work is that only 1% of it is in your blood work, where 99% of it is in bone, muscle, tissue, and brain, including that. So I'm a big fan of getting magnesium because it also has a lot of other beneficial effects on like lowering inflammation. There's research on it itself lowering CRP levels, just magnesium. So that's one thing that's right off the bat that we can do. The other thing is this creatine. And you and I have talked about this before. I talk about it in the CCMI course. Creatine has actually one of the few things that has human evidence on it for concussions. So a lot of the stuff is very preclinical. So creatine, both before a TBI and after a brain injury, show that it can decrease some of the neurological deficits that happen. And the mechanism that it basically works is that it is kind of like spraying quick start into the cellular ATP machinery because it provides a kind of a rapid fuel source. So phosphocreatine, if you remember back to like glycolysis pathways, that's like grade 10 biology. And that is how creatine can actually offset some of those ATP deficits.
And that's something that would be optimized to be in your diet pre-injury.
Yeah, it's a common supplement that a lot of athletes will take. It's very safe. A lot of people, I even remember when I was a varsity athlete, they were like, "Well, don't take creatine. It's dangerous." Just
water and whatever else.
Yeah, and it's true. It does attract water to it, so muscles will puff up.
Yeah.
But that's a secondary thing that's not harmful. It's not harmful to the kidneys. Very good safety evidence on creatine, and so that would be one that I think is quite safe and accessible that people can take to really offset that initial cascade. And then the third one is it's a bit off the, it's an amino acid that's a bit off people's radar, but it's found in green tea. and green tea has a lot of antioxidant benefits, but the amino acid called theanine, what it does is that it decreases excitotoxicity of glutamate. And glutamate is one of the key excitotoxic amino acids that are kind of propagating that initial depressive ATP phase. So theanine, very safe, studied in kids. Majority of the research is actually on anxiety and calming people's minds for studying without making them sedated. So it's kind of promoting alpha wave production. So that's more of a, there's research on green tea, but there isn't research on theanine, but that's something that, from a mechanistic perspective, I think makes a lot of sense.
Just biologically.
Biologically, yeah.
Yeah. Now, let's talk about magnesium a little bit. I know that you and I have talked about this as well. So, why are so many people deficient in magnesium? Like, why is that such a common deficiency? Like, isn't that something that, would be readily available in just standard diet? Is it because of the processed foods? Or is it, I think we've spoken about this before about, like, farming practices and things like that. So, like, maybe kind of elaborate on that a little bit and why it's so commonly deficient in athletes.
It's a great question, and I lecture on this all the time. And I alluded to a couple points, a couple minutes ago. The main reason is that we don't have it in our agricultural practices from a fertilizer perspective anymore. So majority of the fertilizer is nitrogen based, and the reason is that it makes things grow really fast. But what magnesium does in the plant, and by the way, it's not found in the animal kingdom, it's found primarily in the plant kingdom, where iron is kind of the center of that hemoglobin molecule that mammals need to use. Plants, the chlorophyll molecule, which gives it a nice green color, magnesium is the center of that. So you find it in plants, but the problem is that what its job really is on a plant is that it kind of makes things grow strong. And, agricultural practices don't really care about strong. They care about fast, so we can harvest it quick. High yield, exactly.
Get it out there.
So I think there's a depletion in our food sources. And the foods that are richer in magnesium are going to be typically things like your greens. Pumpkin seeds are high in magnesium, so I recommend that a lot to patients, and that has a lot of other medicinal benefits too from a fiber perspective, and molecules that are called cytosterols, and some of the things like tofu also has magnesium in it. But even these don't have enough magnesium to be therapeutic. So I think magnesium is one of those things, kind of like vitamin D and like vitamin C, is a real prerequisite for us if in this kind of high stress culture that we live, that we should be taking regularly. And then
as more of a supplement.
As a supplement, as a supplement. And taking an amino acid form of magnesium, which means just magnesium is attached to a molecule. Primarily, if you find it in the pharmacy, you're going to find it in the laxative aisle, magnesium oxide. That is not the therapeutic type of magnesium. If you need to go to the bathroom, fine. But I like to use one that's attached to an amino acid, like glycine or malic acid, or citrate's not an amino acid, but that's not a bad form either.
So like magnesium glycinate would be up there, magnesium citrate.
Better, more absorbable forms. So they don't have that laxative effect, and they have an additional therapeutic effect, because now the glycine also is a relaxing amino acid. Yeah. So you have like this, a lot of my patients say, I sleep better when I take magnesium.
I take 2 before bed every night.
Yeah.
Since visiting you.
Yeah, and that's a very simple, inexpensive way that you can kind of be affecting things that are more than just TBI, just beneficial things. And then finally, I'd say, I think it really comes down to our digestive systems are constantly under attack, and we'll probably talk about this when we talk about the gut-brain axis. Well, I won't get into it in a lot of detail, but I really think the absorption of magnesium from our foods is not very good, and that has to do with the fact that not only is it not in the foods, also a lot of our inflamed. We know research shows that people that have Crohn's, colitis, you could probably argue on food sensitivities. Anytime there's a permeability issue, inflammation at the level of the gut, so food allergies, that's going to be a consideration that decreases magnesium absorption.
We've got a question from somebody here that just came in. Dosage. What would the recommended dosage be for magnesium? I know the answer, but I'm let you field this one.
Yeah, I think that the important question comes down to making sure that you have the right form. And so assuming that you have the right form, which we talked about, which is an amino acid form like glycinate or malate, you really want to be getting around 200 to 400 milligrams a day of that type of magnesium. And I usually divide the doses. So I don't like to... Yeah, I like to actually split it apart, because if you take all your magnesium at once, you maybe only absorb 30% of that magnesium. So I'd rather you take, one capsule 3 times a day is better absorbed than taking 3 capsules all at once.
Oh, okay.
Yeah, so there's a diminishing returns the higher you go. Same goes for vitamin C, because that's another one of those that is kind of capped out at around 20-30% absorption in the gut.
So 200 to 400 milligrams spread out throughout the day.
Yeah, so like 2 capsules in the morning, 2 capsules in the evening of 100 milligram per capsule.
Right.
And that's about the maximum amount of magnesium glycinate that is pure magnesium glycinate.
Yeah.
A lot of my patients are taking magnesium, but they're taking these magnesium glycinates that are actually adulterated with magnesium oxide.
Yeah, so I was doing this. I was a victim of this. So I went to health food store. You said get magnesium glycinate, and I got it, and I think it was like 200 milligrams per cap.
Right.
And I'm like, I'm taking 400 milligrams of this stuff and whatever. And you were like, how many are in each cap? And when I told you, you were like, no, that's impossible. The most you can get into a cap is like 90 to 100 milligrams. Right. And so basically what they do is they advertise it as magnesium glycinate, but a lot of it is magnesium oxide that's mixed in there as a smaller molecule that allows you to get more in there per space, right? Is that
it's exactly the case. Yeah. It's more of like a bit of a marketing technique. It's a bit of a trickery where it says magnesium on the bottle, so you assume it's magnesium glycinate, but when you read the fine print, sometimes it's not even there.
Yeah.
And, a lot of companies are scrambling the last year to kind of update their label because, what really bothered me as a clinician is that there was a lack of transparency, that they weren't claiming that it was magnesium, pure magnesium glycinate. So I usually like to, I want my patients to get what's going to be most beneficial, and I don't like when they have the world pulled over their eyes.
Yeah. A little filler in there.
Yeah.
So pre-concussion, just to summarize, we're going magnesium, theanine. Now, is theanine a supplement as well, or is that green? Just drink green tea?
Both, I would say, but you can get it as a supplement. Obviously, all these recommendations, I'm going to say it right from the start, is making sure that you're working with your healthcare practitioner. Nothing that I'm saying here is a prescription, but these are considerations from an educational perspective that I think, are worthy looking at. And there's many other things actually, Cam, and we may talk about a number of them in the future. For example, there's evidence on curcumin. There's evidence on, I mentioned green tea. There's plant molecules like resveratrol, N-acetylcysteine. Like we'll touch on some of these.
And are these are all pre-injury? Like, and it's the same thing, same idea. Like
exactly
having optimal levels potentially decreases the severity of the injury itself.
Yeah.
So, like for example, one of the questions we had come in like early was, as a pro MMA fighter, so this person is a professional mixed martial arts fighter, obviously subjecting themselves to potential for concussion, day in and day out. Is there, what would you recommend as almost a cocktail for somebody like that? It would probably depend on a lot of, what their levels are and things like that. But let's say somebody that just wanted to, optimize as best they could at least.
Well, all the things that we just talked about, without, everybody's different. So what I will say is that, it's hard for me to give a protocol if it's not my patient, because I need to kind of have that. But, something like I would say omega-3s is a really important piece. I know we'll talk about keto shortly, but I think omega-3s are probably the best known supplement that is related to neurological health. Sure. Your pregnant women take it, people that are aging take it. And so there's quite a bit of research on omega-3s, both pre and post-injury. Again, I mentioned it takes a while to get these omega-3 fatty acids to be incorporated into the cellular membrane. And once they're incorporated in that cell membrane, when that trauma occurs, now what they're doing is producing more of an anti-inflammatory cascade along with that inflammatory cascade.
So mitigate it.
They will mitigate it, and I think they'll also speed the resolution of it, because we'll talk about inflammation, but inflammation is this two sides of a coin. We often think of inflammation as something we just want to cut and get rid of. But remember, the body is not dumb. It does things always for a reason. That inflammation is part of the cleanup process after that injury. The issue with chronic unresolving symptoms in post-concussion syndrome is that never flips into that resolution phase. And that could be because they are deficient in a whole host of these key resolution factors, and omega-3s are a key resolution factor.
Question up there. Is magnesium threonate or threonate? Is this the same as
threonate,
magnesium glycinate?
It's not. It is obviously half of it's the same, like magnesium is the same, but it's attached to the amino acid called threonate. And this particular amino acid I do use quite a bit because it's probably the most brain-specific type of magnesium.
Threonate.
It has some preliminary research, I believe, out of UCLA and MIT, I believe, or Stanford, MIT, looking at that it has the ability to get past the blood-brain barrier a little bit better, so the absorption is better, so that threonate amino acid brings it up through the blood-brain barrier better. So I find clinically with this particular type of amino acid, patients feel calmer. And glycine does that too, but even this is, I would say, even more. So
even better.
Yeah, I think it is a really good form, and it is a bit more expensive though.
Oh.
So that's the kind of trade-off. Magnesium glycinate is
get what you pay for, as I always say.
Usually, yeah.
Get what you pay for. So I mean, we were just talking about inflammation. Let's get into that a little bit more. So I mean, post-injury, I mean, you first have that metabolic cascade, and more we're finding that a lot of the persistence of symptoms are related to inflammation. I mean, there's been studies done on, for example, elevated CRP levels, which is just a kind of global inflammatory marker. Elevated CRP levels immediately after injury, correlating with prolonged or persistent symptoms, right? Now, that could be due to, let's say, brain inflammation, but it could be due to inflammation in general. If there's soft tissue injuries that correspond with that, that just means maybe it was a more traumatic event and things like that. But just inflammation in general, and I know I've been kind of reading a lot about this lately, and I think it's extremely interesting. And we've been putting people on kind of this anti-inflammatory diet at Complete Concussions for years now, kind of on your recommendation. Let's talk about inflammation and some things that you can do. Let's talk about the gut.
Sure.
Let's talk about the gut-brain axis. And
there's a lot. I mean, there's a lot there. So let's start with, we started talking about that acute pathway, right? So there's that excitotoxicity pathway, but at the same time, almost immediately, there is the stimulation and recruitment of inflammation-producing cells in the brain. These cells are called the microglia. And these very specific immune cells, they hang out in the brain and they don't interact with the rest of the body. So that's the blood-brain barrier. And once these cells become activated, they start spitting out these inflammatory molecules. Cytokines, chemokines, you can measure these. And what they do is that their main goal is to try to get that healing to happen. And it takes that 14 days for, a mild TBI to kind of have some of that resolution. But we're seeing that these microglia even become primed longer than that. So that's that window that is even longer than that. My symptoms are gone away, but I now have this vulnerability window. So I think a lot of that's inflammation. And that inflammation actually impacts the rest of the body. So you mentioned gut, and we'll talk about that. But I want to mention that a lot of the symptoms like brain fog, I tell my patients have brain fog, persistent brain fog, that's a huge issue when it comes to inflammation, specifically brain inflammation, and also the inflammation and its effect on the barrier between the body and the brain, so the blood-brain barrier. And that's a symptom of things like brain fog. Headaches can have some of this, can have an inflammatory aspect, especially cervicogenic headaches have an inflammatory aspect. And now it's starting to have an impact on the rest of the body. And this is what I'm really interested in, both of us have really been grooving on lately, is that we're looking at the effect of this inflammation and how immediately, 3 hours after injury, the gut lining becomes more permeable.
That's wild.
That's crazy.
Yeah.
And the question that always strikes me is why? Like, if you have a brain injury, my gut's not injured. But the body, again, always has the healing process in mind. And so the idea is that I just sustained an injury to my brain. The organism needs to tell itself to slow down. So what that does is that it allows more inflammatory molecules from the gut lining, microbiome, to slow us down. So there's that sickness behavior that starts happening. Like, I'm tired. I'm not feeling well. So we wouldn't just keep going. So it's almost like our own break.
Right.
And so now you have a feedback of more inflammation in the body that goes back up to the brain. And the idea of that inflammation is to slow us down, but also to promote that phagocytosis. So basically cleaning up of that inflammation and resolution of that inflammation.
So basically gut permeability is inflammatory.
Exactly. Yeah.
And the mechanism following brain injury is to tell your gut to become more permeable.
That's right.
To promote inflammation.
That's right.
So there would be a healing reason for that, try and heal the injury, but also potentially to slow things down a bit.
To tell the organism, say, hey, you need to not do what you normally do, and you need to take a bit of a break here.
So
that happens 3 hours after injury, peaks at 72 hours, and is present for 7 days plus after.
And how do you stop that?
Well, I think, this is a very interesting question. So
but do you want to stop it?
Yeah, exactly.
How about that?
I don't think we should stop it. I think that's like when you sustain an injury and the body goes through this process and we reach that threshold where and it's probably shades of gray, but where you really have that sickness behavior that's happening, we should be listening to our bodies. And I know you've been preaching this for a long time about, even though your symptoms, brain symptoms have gone away, there is a bigger window that, I would say, if you have a TBI and you've had those initial symptoms, it's 2 weeks before you're, and I don't know, research comes out plus or minus a couple of days once in a while. But there's a case to be made for that. It takes at least that long to have biochemical, resolution. And so that inflammation, like you said, through the gut is one of those key mechanisms. And I don't know if I'd want to change that acutely. Now, one of the key considerations is when people flip over to the chronic persistent symptoms.
Right.
And I really think, and there isn't really evidence that we've shown this yet, but based on everything that we have so far, is that I think the Achilles heel from a health perspective that a person has going into the injury, and many people have gut dysfunction, many people have hormonal dysfunction, yeah, me too, that is where the dysfunction really sits from a chronic perspective. So a lot of people have intestinal permeability issues to start. And now you have a much more exaggerated response and it doesn't resolve because there's an injury there happening.
It's the same thing with I'm going to apply it to other things. So for example, visual disturbances. I mean, we saw Dr. Blanc talk over the weekend, right? And some of the idea behind that is why do I have this now when I never had it before? And one of the main theories behind this is you probably did have it, but you were able to kind of work around your own dysfunctions because you had the ability to be able to do that. And maybe it's the same thing where it's I never had any gut issues before. Why do I have them now? Well, you probably did have gut issues before, but they were subclinical where it wasn't yet bothering you. But if you continued on that path, you likely would have ended up with them. This now just boom, boom, accentuates, and you start getting it earlier and earlier and earlier. And I mean, this is, and I've seen this firsthand in myself. And I'm a patient of yours as well. And I was having I've had asthma my whole life and exercise induced, so I've always had to take an inhaler before I worked out. And then remember about a year ago I started getting hives when I would work out. So I started getting itchy and blotchy when I would exercise. And you go to the doctor and they're just take a Reactin before you work out. What kind of friggin' solution is that, right? So I'm popping antihistamines before I exercise, and that works for about a year or so, and then that doesn't work anymore. And so I talked to you, and it was all he's this is all your gut. Your immune system is completely triggered. Your histamine response is triggered by gut inflammation. Something's going on with your gut, and we did an elimination diet, which I'm pretty much still on, aside from some few introductions that I've done. But immediately, I haven't needed my inhaler now in about 5 months or so since we've been doing this. I haven't been getting itchy with exercise at all. And literally after 2 or 3 days of just eliminating some of this stuff from my diet, so your glutens, this fog had lifted off my. I didn't even know I had fogginess. And all of a sudden I could see clearly and everything. I felt like I had a leg up on the rest of the world. I felt so much energy. I was sleeping better. And it was instantaneous. And immediately it clicked for me and been how many of my friggin' concussion patients that are explaining this brain fog, chronic fatigue type of stuff, just have this gut issue. And so like for me, it's been like a profound, thing, and that's why I've been getting more and more into it. Anyway, that's just my story.
Yeah. Well, that's a perfect example of what I see with my patients all the time. And yours was just a really dramatic example. Like you were out of breath, you had these hives, you had this immune dysregulation basically happening. Mm-hmm. 80% of the immune system is in and around the gut. Mm-hmm. The gut associated lymphoid tissue. And that is what regulates all of the immune cells they're basically being born and created, and their patterns of recognition are being set right then and there. So if you have a permeability, if you have food sensitivities over time, you might get symptoms like, I have allergies, I have asthma, I get cramping and bloating once in a while. These are symptoms that a lot of people consider normal. Yeah. And they just deal with them every day. These are our concussion patients. Yeah. And they have a TBI, and all of a sudden they have all these symptoms that start happening that don't go away. And it really was now just unearth this underlying imbalance that you really had. And a lot of it happens in the gut. And because the gut is the first place that the external environment often we interact with, think of all the foods that we eat and all the non-foods crap
processed
that we're eating.
garbage.
Exactly. And not to mention things like GMOs and glyphosate. So Roundup was a big thing. That lawsuit in the U.S. has been really front and center in the media. We know that destroys and damages and alters our microbiome. That is a huge, that's a huge issue. So all of these environmental things conspire to always be assaulting the gut to be less than what's optimal.
So in the acute phase, you say, I would just leave it alone. Leave it alone, see what happens, right, over time in terms of like a supplement perspective. Yep. We've been basically providing almost an elimination diet for people anyway. Now, should we revisit that? Should we maybe take a step back on that? Or do you think that that's still the right thing to do? Because inflammation is going to happen anyway, but let's keep it in check. Like, what are your thoughts on that?
I think, I would correct the diet that we've been recommending to our clinicians right now is probably more of just a plant-based diet. I have not gone to the point of making an elimination diet. That's the next step, because it is a little bit more hardcore. Yeah. It requires a much larger degree of buy-in. Like, think of the typical concussion patient that walks into our clinician's office. They are reeling from this thing. Mm-hmm. They have a whole list of acute symptoms. They want to get back to play ASAP. Right away. And they're thinking this is all a brain issue. Mm-hmm. It hasn't clicked into them until a lot of these people do some research. They hear you talk. They hear they see a post by me, and they realize, maybe it is my hormones or my gut or something that's unrelated. So there isn't the buy-in needed to do an elimination diet. So the difference between a brain protective diet, which is what the research is looking at right now, so that is a high antioxidant, a primarily plant-based diet. And what I mean by that doesn't mean vegetarian. That means that you're eating at least 8 different colors of fruits and vegetables every day. The spectrum of the rainbow is more important than I ate a bushel of carrots or broccoli, even though there's medicinal benefits of each one. It's about the bioflavonoids and the antioxidant compounds in the colors. So you want to eat 8 different colors. And then we talk about good fats. We talk about avocado. We talk about coconut oil, which is also kind of controversial. We talk about keto, and again, very extreme, but we talk about eating good fats as part of like free-range organic meats. Those are higher in omega-3s and higher in vitamin K and vitamin E and vitamin A than the stuff that you find from the feedlot type of cattle. So that's the type of diet that we're recommending to our clients, to our clinicians. I think the diet that really rehabilitates the gut, that's even next level, Cam. Yeah. So I mean, I think maybe we could revisit that, and that's definitely what I'm going to be when I'm going to be teaching the integrative and naturopathic side of things, which is a course that we're going to be launching in 2019. That is absolutely what we're going to be talking about.
So, acute phase, plant-based diet. A more antioxidant-based to deal with the antioxidant depletion that happens as a result of the excitotoxic.
Yeah. And I forgot to say, very little sugar. Remember we talked about that? Caloric restriction by 30%, and that really just means no soft drinks, no juices, no extra anything. If it's sugar on the ingredient list,
get rid of it.
Don't do it.
Yeah.
And that itself will reduce calories. Yeah. And when you reduce that calories by 30% and replace it with all these nutrient-dense, real foods, as unprocessed as possible, then you are automatically going to be right away reducing that excessive calories. You know, something like, you know, I'm going to use the worst example, like you know, a Joe Louis or you know, a breakfast sandwich. That's just jam full of fat and sugar and salt and all these inflammatory foods and molecules, like, you know, wheat and gluten is a huge one, which we'll probably touch on again. But that is going to be that's going to be one of those things that are obviously going to make that inflammation worse.
So let's take it from acute. Now it kind of into the chronic spectrum. These are the difficult patients. These are the patients that, you know, like nothing seems to work. They've probably seen 15 different healthcare professionals by the time they get to like, you know,
frustrating.
Me sometimes and probably you. It's probably even longer, right? Like it's just people don't think naturopathic medicine when they think of concussion yet. But I think that they will. It's just becoming you know, so obvious. But so let's get in now to gut health. We have gut permeability. We have, you know, we mentioned elimination diet. What can we do to fix that? And I mean, obviously working with somebody like yourself is going to be the way to do that. But just for the practitioners that are out there, what would we do? What can we do?
Yeah, so I had a great question at the last lecture I did, which was on Friday at Brain Injury Canada in Ottawa. We were there together. Yeah. And the question was, a lot of the stuff you just mentioned, like, you know, organic foods and, you know, plants and all these foods that are not processed. Unfortunately, the way that our system is set up from an agricultural perspective is that these are more expensive. And so the question is how do people afford a lot of this stuff? So the first thing I start with, to answer your question, is eliminate the garbage. Eliminate the stuff that is going to be hurting your digestive lining, that's going to be making it worse. And that is really coming down to eating as, I use the word clean as possible, and that includes vegetables are good to go. Animal meats are good to go, but trying to get the higher quality. Now you see it every single store. It's omega-3 eggs. It's free range. It's grass-fed cow. You know, there's options out there that are much more affordable, and really cutting back on all the processed grains. So think breads, muffins, pastas, because they have other ingredients in it. If you're just eating like a quinoa or a rice or a sweet potato, that itself will remove a lot of the molecules that make the gut more permeable. And that itself is eliminating all the food allergies. So that's the first piece. So the first piece is remove the obstacle to cure. Before even adding anything. A lot of people, the first thing people think about is what supplement do I take? What supplement do I take? And that's the wrong approach. I don't care how much probiotics you take, you are not going to be able to heal a gut that is damaged and inflamed and permeable if you're still eating those foods. The second thing is it's one that's often overlooked is what state are you in terms of your nervous system? And what that means is one of the things that I really look at is the balance between the sympathetic and parasympathetic nervous system. The mechanism of why a brain injury causes intestinal permeability is actually mediated through a nerve called the vagus nerve. And this is the nerve that comes out of the brainstem, and its job is to innervate and supply with impulses from the brain, the intestinal lining, majority of the organs in the abdominal and thoracic cavity. Now, actually, it's more of a sensory nerve than it actually is a nerve that's giving impulses, because 80% of it goes back up to the brain and it's always sensing. So that's the mechanism. That nerve immediately becomes dysregulated, and that's why you have that intestinal permeability. So back to the question about what we can do to heal leaky gut is you need to eliminate anything, especially while you're eating, that's stressful. So I'll give you one example. How many people, when they're eating, have their phone out and they're cruising on their phone? That is a sympathetic action, because you are activating a highly stimulating action, and that is a sympathetic, that's causing that blue light is causing that sympathetic activation. When you are in sympathetic mode, you cannot be in parasympathetic mode at the same time. That's the way those two neurological pathways inhibit each other. How many people watch TV? Yeah. How many people eat on the go? stressed, in the car.
Yep.
We need to sit down and give ourselves the time to chew our food properly and to digest our food properly. Okay, so that's number 2. So eliminate the garbage, eat very low processed, and put yourself in a stressless environment. And then finally, you can add in foods that have some of the gut healing aspects. So for example, there's an amino acid called glutamine. Glutamine is really a key essential fuel for the lining of the intestines. And glutamine is a supplement you can take. It's also found in vegetables like cabbage. And a lot of the molecules that are found in those colorful vegetables, like there's molecules in broccoli that have a gut healing property. I really like bone broth, and that's a big thing now because it has a lot of the collagen, has a lot of the peptides and proteins that also have the ability to heal intestinal lining as well. A really good soup or bone broth is a great food that acutely you can use after a concussion that is really easy to digest, but also has a therapeutic property. So there's many supplements, and I haven't even talked about probiotics, but those are the foods that I would right away take in. And then, starting with a probiotic, the research is pretty clear, especially if you combine it with an omega-3. Omega-3s and probiotics do regulate the bacteria in the gut, and the bacteria ultimately are a key regulator of the intestinal lining as well.
And there was, this Sunman paper here that talked about microbiome. That was a crazy read. I was into that big time, and talking about like fiber.
Yes.
Just dietary fiber.
Good point.
Because that's fuel for the gut bacteria.
That's right.
And we are so deficient in the fiber intake that good fiber. So that's another thing that I would just kind of add to what you just said. Now, in terms of eliminate, the way I describe it to my patients is no dairy, no gluten, no eggs, no refined sugar, no alcohol.
That's right. Alcohol's huge.
Right. And I try to bargain with them a little bit because I think the reason why people want to know what supplement can I take is because they don't want to change their diet.
I know.
They want to crush pizza, right? They want to crush, beers and whatever else. And so getting them to remove something that they love is a lot harder than just telling them to take a pill, right? Our society loves, just popping pills. But
quick fix.
Yeah. Was there anything you'd add to that? So refined sugar, gluten, dairy, alcohol.
I think those are the main ones. Yeah, that's bang on, Ken.
Okay, I'm doing
alcohol does a huge intestinal permeability problem, as well as the blood-brain barrier permeability.
Right.
Alcohol is a toxin when you think about alcohol because it has to be broken down. It's broken down to acetaldehyde. This molecule is much more difficult for a brain-injured person to break down on top of damaging the lining of the gut. So,
and we're learning more about like alcohol and memory and things like that, and it probably very similar mechanisms, right?
So a little bit of red wine is, I would say, it does have some cardiovascular benefit. It is part of the Mediterranean diet. So that's something that I would say is a good place to start. It's really when you become excessive. And
define excessive.
Well, this is a personal question. I would say anytime that you feel that the alcohol is getting to your brain, quote unquote, what that is basically telling you is that my alcohol detoxification systems have been overwhelmed by the amount of alcohol that I have.
So as soon as you're feeling like buzzed,
well, then you've gone a little bit too far. I mean, again, we're talking about you can get away with it if you don't have a brain injury. Mm-hmm. Everyone does, but it's about have I had them in the past and I'm an athlete and I'm doing everything possible? Don't go out and get on a binge drink because that affects memory for weeks after. Mm-hmm. It affects your neurological system, depresses it for over 72 hours. And there was a big thing in our varsity, obviously, program. That was a big issue, as with any university. But a lot of people are like, yeah, I'm fine. But, the predisposition to injury when you're biomechanically not as well is huge, and a lot of guys blew out their ankles, and how much could have that been changed if their proprioception was better,
right,
because they had a really big night on Saturday. So I don't want to be a downer, but but if you're trying to be therapeutic and you're really looking at the evidence, you can't ignore it.
Yeah. So, and I mean, another thing that came up in this paper was just the influence of the gut, on neurotransmitter production in the brain.
Absolutely,
so that's the other kind of mechanism of that gut-brain axis. Now, you talked about microglial priming. What do you mean by priming? What is priming?
Well, priming basically means is that right now the microglia normally are immune cells, and they're basically like sentries. They're like guardsmen. And they basically are patrolling the brain and looking for any infection, any sort of inflammation. But what I mean by priming is that trauma causes the microglia to go into action. So now this microglia is literally like shooting inflammation around, and it's damaging good things, and it's,
Cowboy movie.
A little bit, yeah. That's the Rambo reference. At least that's the way I envision it in my mind. And so prime microglia is one that is producing inflammatory signals.
And brain injury primes the microglia. You get gut permeability, which increases inflammatory markers in the brain that go back up, that now those microglia activate again are
further primed,
and
also now monocytes and macrophages, which are systemic immune cells, now also get recruited to the area of damage to say, hey, there's actually damage here that we don't want scar tissue to happen. So they're trying to clean all that stuff out.
Is there any other thing? So we talked about just dietary, eliminating certain foods, and you talked about a few supplements that can be helpful for getting back in. We talked about keto. Now, I mean, at least from my understanding, one of the big benefits of keto is actually just to avoid the carbohydrate, which a lot of times can kind of promote inflammation. And so ketogenic as anti-inflammatory, ketogenic as ketones for fuel for the brain. What are your thoughts on, keto in general, and then keto for brain injury?
So I think it's important to understand, so everyone understands keto, for those of you that are not familiar with it. It's consuming less than 30 grams of carbohydrates,
which is not a lot, which is a very small amount. Like a beer, I looked it up, is like, I think it's 12 or 15, right? So if you have two beers, you've shot your limit for the day.
Well, that means you can't have any carrots. That means you can't, vegetables still have carbs, and obviously breads and grains have a lot more carbs. So there's multiple mechanisms of action of some of the therapeutic benefits of keto. You mentioned a couple of them. So number one is that once you get into a state that you do not have carbohydrates, the body eventually switches, and this is around 48 hours, switches to burning ketones, which are fats. And typically they'll start pulling those fats out of our fat stores, and that's why people will do a low carbohydrate diet to lose weight. But if you're eating a lot of fat, you can actually now use those fats as ketones as well. And the idea is that, and this actually is an evolutionary survival mechanism, is that we now have a supermarket culture, but our ancestors, and even I would say 100 years plus, and definitely 1,000 years plus, where there were long periods of time, that could be 3 days that they didn't eat food, especially if in the hunter-gatherer type of tribes, where they ate meat, they had a large input of that, and then they don't have that for the rest of the week, or they don't have that for the next day because they're out hunting or gathering again. And so our brains needed to be able to function at a very high level. And so this basically means is that we are not functioning on glucose at that time. And so our brain is actually very good at using ketones for fuels. And that promotes certain anti-inflammatory pathways in neurons. So it both has a fuel benefit, so ketones, mitochondria, better fuel, and also kind of having an anti-inflammatory effect. And I think the third piece that you kind of alluded to is I think a lot of the benefit of the keto diet is by having a positive effect on the gut, by not exposing it to a lot of the inflammatory molecules that are found in grains in general. And we are seeing that more and more, that the gut microbiome changes when you eat a diet that's high in fiber and low in refined carbs. And that's kind of what a keto diet is. It plus high in fat as well.
It's so hard for people to wrap their head around it, because we've been told forever that red meat is the devil, right? And so, maybe just comment on that fact. Like, is it now? Is red meat safe now, or should we still be avoiding it? Like, fat in general. You cook something and there's fat, and you pour the fat out. You always try to skim off the fat, like that type of thing. Now, should we not be doing that? Should we be?
It's a great question, and it's one that I still get like, oh, do you eat meat? And they're like, no, I don't. And they're like, oh, but I eat chicken every day. I'm like, that's still meat.
Yeah.
You know, there's a lot of misinformation around that, and this whole thing comes out of the idea that fats are associated with cardiovascular issues. And there's a huge pharmaceutical industry that was just targeted at cholesterol and bad fats. So the statins, Lipitor, Crestor, this is the biggest class and most lucrative class of drugs in the world, most prescribed. And so there was a huge campaign to vilify fat back in the 80s and 90s. And now you're seeing that the research actually is not that case. So what I tell my patients, Cam, is I tell them it's the quality. So I still think if you go out and eat a burger every day, it's not going to be healthy for you, especially when you start barbecuing it and deep frying it and charring it. There's a ton of research showing that the way that you cook that meat is not good. So you don't want to be overcooking things. But at the same time, you need to balance that with the vegetable piece. So a lot of people eat all that meat and then they eat all the refined junk anyways because they have the
French
milkshake
fries
after.
Yeah.
So what I always recommend is the quality of the meat is much more important than if you eat meat or not. And then also
what you pair it with.
What you pair it with is incredibly important. So it's about, we know that the types of fats that are in even grass-fed meat or wild game is rich in iron, rich in all these minerals, rich in all these cofactors and fats like vitamin K. So I really think it can be a health food. And to be perfectly honest, like I'm a big fan of a plant-based diet, but a lot of the patients that I see have a very difficult time getting better on a vegan diet. And that's because A, a lot of people don't do it right. B, it alludes back to what we originally said. A lot of our plants, especially found in the grocery store, just don't have the right minerals that we, in theory, think that they have. So a lot of these patients are very deficient.
I want to talk quickly just about cannabis, CBD, oils. I know we get that one a lot. Now, I want to wrap up with hormones. That'll probably take us to the end of the time that we have. So just quickly on cannabinoids, CBD oils. I've seen some stuff promoting it almost like an anti-inflammatory, element. I think there's a couple studies just done early phases on rats. What are your thoughts? What's the mechanism? And what are your thoughts?
CBD is all the rage, especially here in Canada right now. It's like everyone, it's all sold out online, and everyone wants to know about it. And I think even clinicians, we don't really fully understand the whole scope of CBD, and I'm now also wrapping my head around it. But I have a lot of patients that have asked me about it, so I'll give you the kind of the Cole's Notes understanding. Basically, we have a class of receptors in our brain called the Cannabinoid System in our brain. So these are specific receptors that we totally didn't understand them years ago. Now we're realizing that they do have specific roles to play. And an easy way for us to understand this system is that it is kind of like the brake in the brain. So it doesn't allow the excitotoxicity and overactivation. Majority of the research on CBD is actually on epilepsy and intractable epilepsy. And that, again, is like neurodischarges in a totally unregulated fashion. So what CBD does is actually offers some of these patients, a lot of hope and a lot of relief because it kind of slows down that hyperactivity. So a lot of patients will say that they sleep better, they're more calm, they have less anxiety. And so I think that's beneficial from a brain perspective. Also, there's an anti-inflammatory effect which the endocannabinoid system works on. So I think working on using CBD for that, we still need to know more about that. As it pertains to concussions, especially because so many of our patients are young, there's research showing that cannabis, which does have THC in it as well, that it does have a detrimental effect on some brain development, lethargy, memory.
There's also mental health issues like psychosis and anxiety and things like that. So now, I mean, just quickly on kind of seizure disorders, and if you think about like what the mechanism is and what kind of happens, you get this excitotoxic event which then results in this kind of spreading depression type thing in the brain, which is very similar to concussion mechanism. So I think the theory holds true, and hopefully we can talk a little bit about hormones now. Hormones have become kind of interesting. I mean, it's been like 20 years in the research, but more on the severe, moderate brain injury, seeing that people have these constellation of symptoms.
Yep.
And your hormones are so multifactorial. And I haven't seen a ton of research on it from a concussion standpoint. Now, I know this is something that you do. Maybe talk about hormone dysregulation, pituitary dysfunction, HPA axis, things to look for, tests that people can request from their doctors. And
such a big question, Cam.
Yeah, I know. But you have 4 minutes. So tell us about it.
I probably have to come back and talk about it at length because I don't think 4 minutes is really going to do justice to it. I mean, I'll give you the overview. Basically, what we're finding is that we talked about the acute cascade, but there is this delayed cascade that happens. And a lot of that is mediated through hormones. What do hormones do? Well, they basically are signaling molecules that tell our endocrine glands what to do. And there is the master hormone secreting organ in the body, gland, is the pituitary gland. And that produces a lot of the key hormones that turn on growth, that turn on our sexual reproduction function, so fertility, for example, thyroid function, which is like energy, body temperature, etc. Our adrenal glands, which produce energy, stress response, and others. And so what we're finding, the research shows that it's worse the more severe the TBI gets, but in even mild situations like sport-related concussion or mild TBI, you're getting anywhere from 15 to up. Some studies show maybe up to 30-35% reduction in these hormones that can happen well after the injury. And this is what's so difficult about this, Ken, is that a lot of people don't make the connection that they are constantly tired. They have a ton of symptoms that look like hypothyroidism, low thyroid. Right. They're always cold. Their hair's falling out.
Yeah, I've had shivers, patients with shivers.
Exactly. So there's a lot of these symptoms that masquerade as all these disorders, but they actually could be coming from a TBI. So I look at blood work and I can see, for example, thyroid stimulating hormone, prolactin. If I see those levels low, I actually asked them, did you have a TBI in the past? And they're like, yeah, actually I did. I had a head injury. I'm like, well, I can see that. I can see that based on the depression in these particular markers. And we know that growth hormone is the biggest one that's affected, and then followed by the thyroid stimulating hormone. And growth hormone affects your ability to heal every single tissue, your brain included, across the board. And couple this with the fact that it's produced mainly while you sleep. And how many TBI patients have problems sleeping?
Terrible.
Over 50%. Over 50% have long-standing sleep disorders. So these are topics that I would love to get into more detail because we can unpack all of them. But suffice to say right now is that this is an absolutely integral part of healing long-term post-concussion syndrome and symptoms associated with that.
Yeah, I mean, I think that's a good point to wrap up. But I want to have you back. I for sure want to have you back, and I'm sure everyone here wants to have you back. And maybe we can just dive into the hormone piece in the future, and then I really want to get into CTE and kind of neurodegenerative conditions. And I mean, the thought process is that it's a catalyst of it's caused by concussions, but I'm starting to think that. How much did the concussion play that role, the increased gut permeability, that increased this neurological inflammation that kept cascading for years and years on end while the players also, drank alcohol.
Exactly.
And also ate like shit.
On opioids.
And all those things. So, and how much of that now plays into the picture of CTE and what we're seeing, even in just neurodegeneration, Alzheimer's. I'm sure a lot of people have,
I think there's a huge connection.
Yeah.
I think that's the missing piece between, as you know, the research is sketchy, and some people are trying to really make that link. But I think what we just discussed is a strong mechanistic rationale of this is a long-term thing that could be smoldering underneath.
Right. Anyway.
Yeah.
Thank you so much for coming.
So happy to be here. Thanks for having me. Thanks for everyone that tuned in. It was a lot of fun, and hopefully everyone learned a lot. Every time I chat with you.
Instagram. What's your Instagram? At Dr. Paul Hrkal?
At Dr. Paul Hrkal. Come check me out. We talk a lot about this, post a lot about this stuff all the time.
Yeah, great. Thanks everyone for coming. We'll see you guys next week. It'll just be me, unfortunately. Take care, guys.
Bye.
Bye.